I'm Nick Ward. I'm the Interim Chief Medical Officer here at Hampshire Hospitals. We're really excited that we have between 700 to 900 million pounds to invest in hospitals in Hampshire, which will allow us to consider how we can deliver care for our population for the next 30 to 50 years. At the moment, Hampshire Hospitals runs 3 sites. There are 2 acute hospitals in Basingstoke and in Winchester, and then a site in Andover, which does a lot of outpatients, day case and diagnostic activity. What we are proposing is that in Hampshire we continue to have 2 excellent acute hospitals to provide all of the services that one would expect from our hospitals, and that is currently happening on Basingstoke and Winchester sites. However, the care will be delivered in a slightly different way than it is at the moment. We're proposing that we have 1 acute hospital where there will be an emergency department, a children's emergency department, where the most sick patients will go, often by ambulance, where there is planned complex surgery and emergency surgery, where there's a critical care unit with intensive care, where there's a maternity, consultant-led maternity unit, and an alongside midwifery-led unit, all within 1 new acute hospital. And on the other side, we planned to base that around planned care, so that day case operations, as well as some inpatient services for the less acutely well, will be provided. Both sites, we plan to have a 24/7 urgent treatment centre, and we estimate that around 60% of attendances that currently go to our emergency department in Basingstoke and Winchester will be able to be seen through the emergency treatment centres, and the hospitals behind those treatment centres will provide the diagnostics and the same-day emergency care that a lot of our current attendances to the emergency department will currently use. We therefore hope that the emergency department in the new hospital will be for the much more unwell patients, as well as providing a specialist paediatric emergency department. The proposals that we have divided into 3 options. For all of those 3 options, the plan is that Winchester will be our centre for planned care. In Winchester, there will be day surgery and inpatient wards, as well as a full range of diagnostic and outpatient services that actually what most people tend to use on a day-to-day basis when they use our hospital services. There will also be a 24/7 urgent treatment centre that will be run by doctors and specialist nurses that will be able to manage a lot of the same-day care that's required from our current emergency departments that we provide in Winchester at the moment. We are also suggesting that in option 1, we build a new hospital on the current Basingstoke hospital site, which will provide the acute services, the emergency department, and the complex and emergency surgery that I discussed earlier. In option 2, we propose that new hospital is built on a site near junction 7 of the M3, and we will continue to provide some outpatient and diagnostic and some day surgery on the current Basingstoke hospital site. In option 3, the main difference is that we will continue also on the current Basingstoke site to provide some inpatient wards that would be nurse-led and manage to support some step-down care, perhaps from the acute hospital, that will allow us to provide some of that care closer to the current Basingstoke site as we are at the moment. Why do we need to make these changes, and why are we thinking of the way to separate the care that is currently provided on both of our Basingstoke and Winchester sites? Well, there's a number of reasons why that is. Our population is changing, and therefore the needs of an acute hospital are changing. In Hampshire, we're expecting that the population of over 75s will increase by 50% over the next 10 years. And we know that the elderly population, particularly those of over 75, are much higher users of hospital care and healthcare in general. and therefore we need to consider how we can use our services to the best benefit. In addition, at the moment, we have a number of specialist services that are provided on both Basingstoke and Winchester sites that, by bringing them together, we would be able to use the expertise of the staff and the numbers of patients that would increase, that would allow us to reach national standards to provide that care. As an example, we currently provide maternity and neonatal services on both Basingstoke and Winchester sites. If we were to centralise the consultant-led maternity services and to centralise our neonatal care, that would allow the numbers of mothers delivering and the numbers of babies being looked after in the neonatal services to reach the national standards, to allow us to maintain both an expectation of senior consultant level staffing in our maternity areas, as well as being able to manage to maintain a level of neonatal care that will allow us to keep more babies locally than we currently do at present, as a number of our more premature babies need to be transferred to other units at this stage. In addition, providing a specialist paediatric emergency department will be an increased quality of care than we're able to provide now, as the children are looked after in areas alongside the adult emergency departments at this stage. Our current buildings, although well loved and used every day by our amazing staff, are coming to the end of their lives. Basingstoke Hospital Tower Block was built in the 1970s and is no longer fit for purpose for providing a modern acute hospital setting without significant amounts of money being spent to improve that. Similarly to our Winchester hospitals, of which there are buildings of varying ages, all of which require significant investment to uplift. We know that building a new hospital is the most economical way to provide hospital care that is needed for the next 30 to 50 years. It's really important in the NHS that we make sure that we're spending our money in the best way possible. Through the options that we've described, we really feel that we will be able to provide better care by using the money more effectively and spending money on patient care rather than spending money on looking after our buildings as we're having to do at the moment. We're really excited that we've come to the stage of reaching public consultation, which launched this week. We have until the 17th of March to gather opinions and views on how the changes that we're proposing for hospital treatment across Hampshire will affect you and your family's use of our hospital services. We'd be really keen for you to use the opportunity to tell us what you think. Please log on to our website at Hampshire Together, as well as or scan the QR code that will allow us to understand your views. We have until the 17th of March to gather as much information as we possibly can, following which all the information we have will be used to consider our final decision making around how we support and use this once-in-a-generation opportunity of investment for hospitals in Hampshire.